Good evening. Welcome to the Oncobite, learning oncology bite by bite. Today, I will discuss about breast cancer chemotherapy. And breast cancer is the most common cancer among women worldwide, and chemotherapy remains a important treatment in many settings. In this video, I will talk about the role of chemotherapy in breast cancer, especially in early breast cancer and also locally advanced where no MEMS is present. And neoadjuvant chemotherapy before surgery to shrink the tumor, make breast conserving surgery possible and assess treatment response. When we use neoadjuvant chemotherapy in case of inoperable disease, that is the tumor is not operable and পেশেন্টকে সার্জারি করতে পারছি না, পেশেন্টকে প্রথমে আমাদের কেমো দিয়ে টিউমার সাইজটা ছোট করে নিতে হবে in case of T4 disease and in case of N2 N3, that is in this case the patient is not operable, and in selected patient with operable disease the patient is operable but patient wants to conserve the breast in case of hormone positive HER negative breast cancer when tumor size more than 5 cm and also when lymph node is positive we want to make the node negative, and in case of high risk type of tumor, that is triple negative breast cancer and HER2 positive breast cancer, we should give chemotherapy in case of T2, that is tumor size up to 5 cm and N1, and also can be considered up to T1C N0, that is tumor more than 1 cm. And also we can give chemotherapy after surgery, that is adjuvant chemotherapy after surgery to reduce the risk of recurrence. রিকারেন্সের রিস্কটা কমাই দিবে, স্পেশালি ইন হাই রিস্ক অর নোট পজিটিভ ডিজিজ। কোন ক্ষেত্রে? নোট পজিটিভ ডিজিজ বা হাই রিস্ক পেশেন্ট তাদের জন্য। কাদের জন্য? 0.5 সেন্টিমিটারের ওপরে, মোর দ্যান 0.5 সেন্টিমিটার অ্যান্ড node microscopic node positive or positive disease. Microscopic node positive, that is nodal size microscopic 0.02 to 0.2 millimeter, that is 0.222 millimeter. This is the node microscopic nodal disease. And all cases we will give adjuvant chemotherapy except hormone positive HER negative, that is the tumor condition is good where we choose oncotype DX status for giving chemotherapy, and also when N0 with high risk status, who are they? When triple negative breast cancer and HER positive, and also patient with lymphovascular invasion or poorly differentiated, that is high grade cancer, and when proliferative markers are high, that is Ki67 more than 20%, p53 mutation present, and mitotic index, mitotic count, high mitotic count, mitotic index more than 10 per megabase. In this case we will give adjuvant therapy. And what is the interpretation of oncotype DX? Oncotype DX, it depends on premenopausal and postmenopausal status. In case of postmenopausal status, it is low risk and high risk. High risk we will give chemotherapy adjuvant, that is score 26 or more, and if it is less, then we can skip adjuvant chemotherapy. And in case of premenopausal lady, if node 0 n0, no node positive, then status is low, intermediate, high. Low risk less than 15 up to 15, score up to 15, that is we can escape chemotherapy. And if it is 25 or less, more than 15, then we can consider, that is plus minus, intermediate risk. And if it is high, more than 26 or more, then we will give chemotherapy. And in case of nodal positive, that is N1, then we must give chemotherapy if it is 26 or more. And if it is less than 26, that is intermediate risk, we can give, consider or not. As it is hormone receptor positive, HER negative, then we should give adjuvant chemotherapy along with adjuvant hormonal therapy. And we can, the alternative option is ovarian function suppression with endocrine therapy. That's all for today, and thank you for watching. If you want to have more bite-sized oncology learning, don't forget to follow for the next topic. Thank you.